Hello everyone, this is Dr. Arya, your pathology faculty. Now we will be studying about the coagulation disorder. Okay, now from coagulation disorder you will be getting a short note. Okay, so study that topic in that perspective. Now, coagulation disorders are basically conditions that are characterized by abnormalities either in the blood clotting process that leads to the bleeding tendency or the thrombocytic tendency. Now, what are the 4 steps that are involved in your hemostasis? First one, there is vascular constriction. First, there will be vascular constriction. Then there will be platelet plug formation, that is the primary hemostasis. Then there will be coagulation cascade, that is your secondary hemostasis. And there will be fibrinolysis. Coming on to the coagulation cascade. So you have the pathways, right? The intrinsic pathway, extrinsic pathway, and a common pathway. Now, in the intrinsic pathway, you have factors. You have the factor 11, you have the factor 12, factor 9, and factor 8. They are activated by contact with negatively charged surfaces. In the extrinsic pathway, you have factor 7 and you have the tissue factor. But in the common pathway, what are the factors you have? You have factor 10, 5, and 2. Coming on to the classification of coagulation disorders. You have congenital and acquired one. Okay. So see guys, in the congenital one, either you have the single factor deficiency or you have the multiple factors deficiency, right? In the hemophilia A, what is the deficiency? The deficiency is there in the factor 8. Hemophilia A, factor 8. Hemophilia B, factor 9 deficiency, that is also called as the Christmas disease. Okay, since Christmas is also coming, so it is called as a Christmas disease. Just remember that. Then you have von Willebrand disease and the deficiencies in the VWF factor. So these are the single factors deficiency. Now the multi-factor deficiency that you have, first thing first, you have congenital afibrinogenemia. That is due to the absence of fibrinogen. Factor 11 deficiency, hemophilia C. And factor 13 deficiency, that is due to the delayed bleeding. Then you have the acquired disorders. Now in the acquired disorders, you have the deficiency of synthesis, like in the liver disease and vitamin K deficiency. Then there is consumption of factors, inhibition of factors, and autoantibodies against the clotting factor. Pathophysiological mechanism that is there. First thing first, there is reduced synthesis of clotting factors. Okay, this happens in your liver disease and vitamin K deficiency. Example is when there is decrease in factor 2, factor 7, 9, and 10. Increased consumption is seen in DIC, that is all factors are consumed. Inherited deficiency is there in genetic mutation, and the example of this is hemophilia A and B. Inactivation of antibodies there is seen in autoimmune system, and there is acquired hemophilia. What are the clinical manifestation? First thing first, you have to see the symptoms. There will be easy bruising, there will be muscle hematomas, epistaxis, menorrhagia, GI bleeding, and hematuria. What is the pattern of bleeding? There will be platelet disorder and there will be coagulation disorder. In the platelet disorder, it can be mucocutaneous bleeding, and in the coagulation disorder, it can be deep tissue bleeding, right? What are the investigations I will do? Here I have written the test, pathway assessed, normal range, and interpretation. Let's see them one by one. First thing first, you have the bleeding time. So in the bleeding time, we will assess the platelet function. Normal range is 2 to 7 minutes, but the interpretation is in this kind of disease, there is increased in platelets. Okay. So this represents that I am dealing with VWF disorder. Then prothrombin time. I have to assess my extrinsic pathway and the common pathway. Normal range is 11 to 15 seconds. It is increased in factor 7, 10, 5, 2, and 1 deficiency. Then you have the aPTT. It is used to assess your intrinsic and common pathway. Normal range is 25 to 40 seconds. It is increased in factor 8, factor 9, factor 11 and factor 12. Thrombin time, I need to assess it because it is the final step. Normal range is 15 to 20 seconds. It is increased in low fibrinogen. Platelet counts, platelet numbers. Okay, this much is the normal range and it is decreased in thrombocytopenia. Now, we will study every disease in details. First thing first, you have is the hemophilia A, that is your factor 8 deficiency. Now, this is a X-linked recessive, that is XLR you can say. Okay, I'll write it also for you. Okay, it is X-linked recessive disease. Okay, the prevalence is 1 in 10,000 males. Pathophysiology is that there is deficiency or dysfunction of factor 8, as a result of which what will happen? There will be defective in the intrinsic pathway and decreased in the thrombin generation, which will cause the impaired fibrin clot formation. What are the clinical features? There will be spontaneous deep bleeding, there will be no delayed or after injury, there will be no petechiae, and there will be a possible family history. What are the investigations I will do? Order in the investigations, I am able to see the PT and BT platelet counts are normal. There is increase in aPTT and there is decrease in factor 8 deficiency. Okay. For the treatment, I have to give the replacement of this factor. I have to give gene therapy and I have to avoid aspirin and trauma. Next thing is hemophilia B, that is also called as the Christmas disease. Okay. So it is due to the factor 9 deficiency, X-linked recessive, and it is clinically similar to your hemophilia A. There is decrease in factor 9 assay. For the treatment, you have to give a replacement to this factor, right? Next thing that you have is von Willebrand disease. Okay, now mark this with me. It will be asked in your university exams. It is the most common inherited bleeding disorder. What is the pathophysiology? There is deficiency or dysfunction of von Willebrand factors. Okay, what are the types? You have 3 types: type 1, type 2 and type 3. Type 1 is mild, type 2 is dysfunctional, type 3 is rare and severe. Just remember this. What are the clinical features? In the clinical features, there will be menorrhagia, there will be easy bruising, prolonged bleeding and mucocutaneous bleeding. What are the lab findings? I am able to see bleeding time will be increased, aPTT will be increased, PT will be normal, platelet count will be normal and VWF factor will be decreased. Everything is either increased or normal, only the VWF factor is decreased. For the treatment, I have to avoid the NSAIDs and give the replacement of these factors. Now next thing about the DIC, although I have told you separately also about the DIC, we will just have an overlook that it is acquired consumptive coagulopathy. Causes are sepsis, trauma, malignancy. What are the pathophysiology? There will be bleeding and thrombosis. Clinical features, there will be petechiae, 𝗖𝗵𝗄𝗆 and there will be ischemia. In the lab findings, I am able to see what? I am able to see there is increase in PT and aPTT. Okay. Then in the treatment, I have to treat the underlying cause. Next, coming on to the vitamin K deficiency. Now, the vitamin K deficiency, what are the causes? The causes can be malnutrition, biliary obstruction, antibiotic therapy and newborns. Newborns mainly have decreased or deficiency of vitamin K. That is why they are given the vitamin K injections as well. In the lab findings, I am able to see there is increase in PT and aPTT. There will be normal platelet. What is the treatment? For the treatment, I have to give vitamin K supplements. Coming on to the next thing, that is the liver disease associated coagulopathies. Okay. Now, what is the mechanism? There is decrease in synthesis of most coagulative factors. There is decrease in the clearance. What are the lab findings? In the lab findings, I am able to see what? There is increase in PT and aPTT, decreased in fibrinogen and there will be thrombocytopenia. What will I do for the treatment? Treat the underlying cause and give the fresh frozen plasma. This is a very beautiful summary table for all your coagulation disorders. Okay, just study that very, very well. Okay. Now, in hemophilia A, deficiency is factor 8. X-linked, PT is normal, aPTT is increased, BT is normal, platelets normal. Key features is there is hemarthrosis. Hemophilia B, factor 9. X-linked, what is increased? aPTT is only increased. Von Willebrand disease, it is either autosomal dominant or either autosomal recessive. Key feature is there is mucocutaneous bleed. DIC, multiple factors are involved. It is acquired. Everything is increased except one thing, platelet is decreased. Vitamin K deficiency has 2, 7, 9, 10. 2, 7, 9, 10. Remember that because it will be asked. Okay. There is increase in PT and aPTT, and BT and platelets are normal. Liver disease, multiple factors are involved. Inheritance is acquired, and PT, aPTT is increased, platelets is decreased. Okay. Now, what are the management? For the journal measures, you have to avoid the trauma and aspirin, treat the underlying cause and blood component. So what are the specific treatments you have? So for hemophilia A, you have to give the factor 8. For B, factor 9. For von Willebrand factor, give that. For DIC, you can give fresh frozen plasma. For vitamin K deficiency, give the vitamin K injection. Liver disease, fresh frozen plasma or vitamin K injection. What are the complications? There can be life-threatening hemorrhage, there can be joint deformities, anemia and shock, and secondary infection, and finally the person can land up into the death. Okay, this was all about this chapter. If you have any sort of doubt, please don't hesitate. Please feel free to ask me. Please feel free to DM me. Thank you so much.